Hello, I'm Dr. David Rawson, Clinic Director of the TMJ and Sleep Therapy Center of London, Ontario. My staff and I have created a short video for you today to demonstrate the application of the phonetic bite technique as used in dental sleep medicine appliances. Before we go chairside, a couple of words about the difference between our approach, which is three-dimensional, more holistic, and more in tune with the patient neurology, and the conventional two-dimensional approach that we take by looking at two sets of teeth and deciding what is a better position. We are going to take the onus out of the doctor's mind and out of the hands of the clinicians and actually ask the patient's brain neurologically where's a good starting place for our bite registration. So we're going to extract the mandible from the cranium metaphorically and ask our patient to help us situate in three dimensions where the mandible would be best suited to open up the airway and reduce the amount of sleep apnea and snoring. We're now going to go chairside and demonstrate these principles in practice. Clinically, we're going to go chairside and check our patient's occlusion before we actually take our phonetic bite. So our patient is going to demonstrate her normal occlusion, biting on her back teeth. And just up a bit, and you'll see that she has an overbite of about 50% and an overjet of, say, 3 millimeters. What we're going to do is demonstrate using phonetic bite technique how her neurology will place her mandible in the most optimum place to maximize her airway. We do that by counting numbers using an S sound called the sibilant phonetic bite technique, essentially a repetition of the S sound. So we're going to ask our patient to start by counting 66 and up into the 70s with me together, and we'll focus on how her mandible moves forward to create a small space to make that S sound. So when you're ready, we'll start with 66 and we'll count together. 66, 67, 68, 69, 70, 71, 72. You'll notice that every time she makes an S sound, can you do it again? 66, 67, 68. You'll notice that her upper and lower incisors almost touch. Her mandible has moved quite a distance to create that space. So now we're going to ask the patient to repeat a different number, being 75, and this will give us the maximum vertical opening that we want to record to start our sleep appliance therapy. So rather than count from 66 to 76, we're going to ask our patient to repeat the number 75 and drag out the 5 note like this. 75, 75, 75, 75. Thank you. Okay, now clinically what we observed was the maximum distance, can you open and close, that the patient demonstrated by holding the note 75. And what my assistant and I had decided was to use a series of round tubes or sticks that she will occlude on while we take the bite registration. So now we're going to place a round plastic tip, which is actually a disposable saliva ejector, and she's going to rest, you'll notice, in an end-to-end position, and I'm simply going to inject fast setting silicone bite registration between her upper and lower teeth to record that space. And when we have an excessive amount of vertical like this, you'll note that we have to be careful to inject slowly to record the occlusal surface of the upper and lower teeth. When I get to the center, I will move to the other side. Now we note that our patient seems to have slid forward a few millimeters, and we'll make a record of that clinically and adjust it in the lab. I'm just going to reach over to the other side and inject the other side the whole time the patient's being held on a round tube as opposed to a flat surface as in a George gauge application, because we want to correct any mandibular asymmetries. And I will hold that. My assistant takes the gun away, and we just tell our patient to relax for another 30 seconds until we confirm it's quite firm. We, of course, in our office record the jaw position in this bite registration, which we won't demonstrate today. So we'll now simply remove the tube. The patient doesn't move. We simply remove the tube. She doesn't want to give it up. She's a hungry girl. Thank you. Turn a little bit so we can show the people there's a fair size opening. You'll see in a few minutes how that translates to her clinically and on the articulator. Now we're simply going to ask the patient to work with the assistant to wiggle and slowly pull this out. And it was able to come out in one piece. Thank you. And this is a perfect record of her occlusion, upper and lower, and this becomes our phonetic bite for our dental appliance.